Bismillahirrahmanirrahim. Dear participants, Assalamu alaikum. I welcome you all on behalf of Shifa College of Medicine, Shifa College University, and Shifa International Hospital to attend this webinar. My name is Dr. Fahad Azam. I work as Associate Professor of Pharmacology at Shifa College of Medicine, and I will be moderating this event today. The topic of today's webinar is medical education in COVID-19 pandemic, challenges and opportunities. The objectives of this webinar are to outline the innovative online teaching and online assessment experiences in various setups, highlight various strategies to overcome challenges of e-learning and e-assessment, and discuss anticipated trends in medical education in the post-COVID era. I will introduce our guest speakers and panelists shortly, but before we proceed any further, I will request one of our panelists, Professor Dr. Muhammad Amir, Dean of Faculty of Health Sciences, to lead us through recitation of Holy Quran.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم فتعالى الله الملك الحق ولا تعجل بالقرآن من قبل أن يقضى إليك وحيه وقل رب زدني علما. In the name of Allah, the most merciful and beneficent. So high above all is Allah, the sovereign, the truth. And O Muhammad sallallahu alayhi wasallam, do not hasten with the recitation of Holy Quran before its revelation is completed to you. And say, my Lord, increase me in my knowledge. وَمَا عَلَيْنَا إِلَّا الْبَلَاغُ. Thank you very much.
Jazakallah. I now welcome all our panelists and guest speakers, and I will introduce them to you. We will give you their detailed introduction and background later during the session. But just to summarize, we have an international speaker, Dr. Janet from University of Liverpool, and international panelist, Dr. Ikram Birni from Sultan Qaboos University in Oman. Similarly, we have a national speaker, Vice Chancellor of one of the most prestigious university of our country, King Edward Medical University, Professor Dr. Khalid m.gondal. We have our Vice Chancellor of Shifa College University, Professor Dr. Muhammad Iqbal Khan. We have a panelist from Shifa College University, Dean of Faculty of Health Sciences, Professor Dr. Muhammad Amir. We have a panelist, Professor Dr. Rahila Yasmin from Rifa International University. And from Shifa College of Medicine, we will have presentations by Professor Dr. Rifat Shafi, Professor Dr. Abda Shaheen, and Dr. Waqas. I would also like to thank our webinar team at this moment who are in the background today, but they played a very important role to make this event possible. Our webinar team has Ms. Sobia from Department of Health Professions Education, Ms. Tanya, who would be managing this Zoom meeting. Ms. Tanya, if you could say hi, because I'll be interacting with you during this meeting. If you could hear me, if you could listen to that. And yeah, we would also like to thank Dr. Shazia, Dr. Muniza, and Dr. Tahira from Department of Health Professions Education. I will now request our first keynote speaker, Dr. Janet from University of Liverpool, to share her presentation with us. But before
teaching purpose, let's look at the advantages of asynchronous teaching. There are many, but they come down to these two important points. First, the learner can revisit the communication, whether it's a video or a text, multiple times. Now, this is helpful for any student who's struggling with understanding, but particularly students with poorer language skills or a weaker educational background. So it helps all students clarify their understanding. It also gives the learner the opportunity to study at a time which is best suited to themselves. The second important point about asynchronous learning and teaching is that both teacher and learner have time to stop and think. This means they have time to reflect. As above, this helps students with weaker language skills to formulate their responses, and it helps less confident students to participate. It encourages more thoughtful contributions. Of course, there are challenges with an asynchronous approach. These are the challenges that I think are most important in order of importance. It may be difficult to create the energy levels or buzz of a face-to-face lecture or group discussion. I have seen very engaging online discussions, but that is difficult. The more important issue is that the teacher cannot control when the learner chooses to participate. And now this puts a greater burden on the learner's own self-organisation and willpower. And it means that we have to put more effort into helping our students develop those time management and self-organisation skills. They will learn them, but it takes time. Finally, it's difficult or perhaps impossible to replicate certain environments where a learning task requires the teacher to be observing and give immediate feedback. Imagine a dental student going into the clinic for the first time to cut a cavity, having practiced on phantom heads. And I have been a patient in such a situation. I was confident as a patient because the clinical tutor was there checking at every moment what the student was doing. And I can't imagine that confidence with student or patient if the lecturer was at a distance watching what was going on over a video. We haven't yet got virtual reality to the point where a tutor could check at a distance how a student was doing a physical examination in order to make a diagnosis. We may get there one day, but I don't think we're there yet. Actually, before I go on to some teaching tips, I'm going to give you a couple of examples of how you would think through these basic teaching situations and decide whether to use asynchronous or synchronous means. Suppose you're teaching basic physiological or anatomical processes to first or second years, and you already have a lecture. You would first of all divide that lecture into 15-minute segments. It's regarded as good practice not to have material online for more than about 15 minutes to help people concentrate. You would perhaps make a video, or you would perhaps hold webinars and record them. But either way, you would make that material available to students with very clear instructions about what to do with that material. You would add links to online resources so they can consult those quickly. You might add self-assessments, multiple choice questions, so they can check their own understanding. In any case, you would set up a channel so that they can ask questions at any time when they're viewing the material. And later, you can gather these questions and answer them, again, either by video or text, so all students can see the answers. Another example, based on work I've done with the European Hematology Association. This is teaching diagnostic skills. So you start by dividing the students into small discussion groups, and that might be on WhatsApp or Google Meet, which have the facility to have multiple small groups. You present a patient scenario. That could be by video, by text, by PowerPoint. Again, you give very clear instructions about a timeline that the students have to arrive at their first differential diagnosis, which they have to post. You might then choose to provide further information, as in a real situation, further test results, which would allow the students to make a final diagnosis. And again, they know what the deadline is for them to discuss that and post their results. And with postgraduate students, you might go a step further and ask them about the management of this patient. When all these posts are in, you can make a video or you can hold a webinar, either synchronous or asynchronous, therefore, where you go through your process of decision making and you make sure that you respond to each group's suggestions directly on the text or within the webinar. Here are some teaching tips for getting the most out of online teaching. There is so much guidance out there. I've kept these teaching tips very short. I've already talked about keeping videos short and about structuring students' engagement with care. It is so important to have very clear instructions and very clear deadlines. I think it's valuable to allow students to choose the software or applications that they use for collaborating among themselves. And I want to add one more tip to these, which is always keep a line of communication open with students. They must be allowed to ask questions at any point. You don't have to answer them at any point. You can wait and gather them together and answer when you know what the students' main concerns are, but they must feel that they can contact you and ask questions at any time. Most software will have a range of functions, both synchronous and asynchronous, but are best suited to some rather than others. Think about Skype, designed as a synchronous application, just like a phone call, but with the facility to write to each other by text as well. Similarly, WhatsApp, a text messaging function, but if you get frustrated with text messaging, you can actually phone somebody. My view is always that you use the simplest for yourself and for the students. I'm not a lover of technology. I use it because it helps me teach. And I ask colleagues what they use and recommend. I take their advice. Again, there is a huge amount of guidance out there available. The most important point I want to leave with you is that we could regard this COVID-19 era as a once-in-a-lifetime opportunity to transform the learning environment for our students for the better. So let's embrace it and move into the future of education. Thank you.
Thank you so much, Dr. Janet. That was an insightful presentation. Thank you. We actually have a lot of questions coming up from our audience, but we will only take one question for now. And that question is, right now, would it be too premature to take online learning as a first line of education, as first line of education tool, rather than taking it as an alternative or a compromise?
Personally, I think that it's not too soon, that we should be doing that for most of the syllabus. I think one of your colleagues later is going to talk about what Shifa is planning to do, and she will be very clear that at the moment, a lot of the skills learning is going to go on at the university in a face-to-face, or at the hospital in a face-to-face situation. I don't think we're at the point yet where we can do really good skills development in an online environment, although we can do some of that. But for the delivery of knowledge, for the basic skills learning, for a lot of that, for me, online learning would be the first option rather than a substitute.
Thank you, sir. Thank you so much, Dr. Janet. That was a very interesting answer. Actually, I have been asked to read a disclaimer that the faculty CME planning committee reviewer and moderator have no relevant financial relationships to disclose. Okay? We will be taking more questions later on, but for now, our second guest speaker for today is Vice Chancellor of King Edward Medical University, Professor Dr. Khalid m.gondal. King Edward is the most prestigious medical institution of our country. Dr. Khalid has contribution for both undergraduate and postgraduate education and also holds a PhD degree in medical education. Dr. Khalid m.gondal has also served as Senior Vice President of CPSP. So I will now request Dr. Khalid Gondal to please share his presentation with us. So over to you, Dr. Khalid.
Can you hear me, please?
Yes, sir, we can hear you. Yes, sir.
Bismillahir-Rahmanir-Rahim. Dr. Janet, Dr. Ibrahim, Professor Iqbal, Professor Amir, and dear audience, ladies and gentlemen, assalamu alaikum. I think I'm very grateful to the Shifa International Medical College and the university for inviting me on this very important webinar, which relates to the innovation in online teaching and learning, something about the assessment and the strategies to cope with the current challenges of e-learning and e-assessment, and similarly, the anticipated trends in post-COVID scenario. Now, you know, the King Edward Medical University has completed 160 years of excellence in the medical education. This is the main Patala block, and I would like to invite all the participants to visit King Edward Medical University. You will see the night picture and the day picture you have already seen. Now, during this COVID challenge, the King Edward Medical University developed some innovations and strategies to cope with these challenges. King Edward established the Department of Telemedicine, which I'll be discussing, I think, in the next few slides. We have got 7 attached hospitals, and we remain among the topper as far as service delivery and treatment of the COVID patient is concerned. Over 2,500 positive cases, they were admitted, treated, and there was time. The number of the patient at one time, they were 423, and by the grace of Allah Almighty, they are now less than 30. But I don't want to go into the service delivery, but that is not the topic of today. Something about the workshop, seminar, online teaching, virtual training, the webinar, and the conferences. Research is an important component of any university, and the way forward and the anticipated trends in post-COVID scenario. Now, we had the first case of COVID on 26th January, and before that we had the teaching and training courses, and on 18th March we established the Department of Telemedicine because the outdoor services, they were going to be suspended. So we provided the telemedicine services to the patient, and our postgraduate and undergraduate, they were also involved. This department was inaugurated by Honorable Chancellor and the Minister of Health and the various dignitaries from armed forces and from civil setup. They visited this telemedicine department, which is to get providing the state-of-art services like tele outdoor, where 10 specialists, they are available daytime to all these patients. Similarly, we have separate tele-psychiatric help desk, and we have got tele-corona help desk, which works 24/7. And we are using this for the research purpose. Currently, over 5,000 the patients, they are visiting our telemedicine. They are getting the consultation from telemedicine department in a week. And this is something about the shift and the feedback of these patients, their symptomatology and all those things. Then King Edward Medical University had the international and national webinar for our under and postgraduate students. We were the first institution invited. Our Chinese friend, 8-member delegate, visited King Edward Medical University in March, and we shared our experience and we learned something from them, because they were the first country where the COVID pandemic was initiated, and they faced that challenge and they overcome that challenge successfully. Similarly, we had the knowledge sharing through our international webinar. The Federal Health Minister, the provincial health minister, and similarly the chairman HEC. They discussed various innovation strategies, learning, assessment techniques, all these things they were discussed in the various seminars. We had one major seminar with the China well-renowned International Medical Education Alliance. The seminar was inaugurated by the president of the China, and over 60 universities they participated and they shared their knowledge. Then coming back to the main topic, that is the online education and the training, and I think very rightly mentioned by the Honorable Speaker, Dr. Janet, we have to have some changes in the instructional strategies, and anticipating the trends. These changes should be according to the need of our students. We in different meeting with the Higher Education Commission of Pakistan and Punjab, the various strategies they were discussed, how they are implemented, they have to be implemented. The university they participated, knowledge sharing that was done at King Edward Medical University level. We started the online teaching, online classes. We have the LMS portal. We used our official website. We had our official YouTube channel, Microsoft Teams, and Zoom technology that was used for undergraduate teaching. The postgraduate, they are already there. They are working in the hospital and they are being involved in the patient care and hand-on teaching and training. Similarly, we had the campus management system where all 5 undergraduate classes they are involved along with the allied health sciences, and we have got the electronic logbook system for our postgraduate resident where monitoring of training is going on through this electronic system. And for the students, we have also provided the online psychological support and the consultation. This is the online monitoring of the student about their training, their clinical pathological conference, their research, all these things, they are there online on their e-log system. Then coming back to the assessment, we have got the undergraduate classes, we have got the postgraduate classes. In undergraduate classes, the anticipated examination, that is the supplementary examination of the final prof, then are the others. As far as the undergraduate examinations are concerned, we conducted our supplementary examination for final prof, but there were some students which were not residing in Pakistan. For example, they were in UAE, Afghanistan, and some other country, and we arranged online examination for them. And the assessment techniques used in general for the student that include online quiz, online assignments, then there were live interactive session, and evaluation was done through the e-portal. And as mentioned by the Honorable Speaker, King Edward Medical University used both synchronous and asynchronous techniques for teaching and the assessment. Now this is the live session of the student assessment that is going on. These 3 students from UAE, from Afghanistan, from Middle East, they are being assessed in the scenario. The questions, they were of MCQs, one best question. They are solving those questions, and our examination department is monitoring the environment in which they are being assessed, and similarly everything is online, and then the result was formulated just after the completion of their assessment. And this is also something about the monitoring and assessment of the students, mainly the electronic system that helped us a lot. College of Physicians in Pakistan, we just mentioned, I have been involved in the management committee. I think that is the main postgraduate body of the country, and the college just conducted its part 1 examination on 6th July, and these were the number of the students, about 4,273 students. They had the online examination at various centers of Pakistan, having, I think this center was in all 4 provinces of Pakistan. This is the online examination of part 1 that is going on at various centers with a central monitoring of these examination. In SOPs of Corona, they were observed, the social distancing, the hand sanitization, the mask, provision of mask, they all were there. and we were through in this online assessment of the students of the part 1 examination. Then we also take the feedback from these students, as you just took the feedback, I think at the start of this session, and about our online training, the lecturing and the assessment, and 80% of the students, they were satisfied on our online methodology of the teaching and the virtual training. Research, I have already told you, is a very important component of any institution. In COVID scenario, we come up with the special issue of Annals of KEMU University, where 39 national and international research papers they are there. The publication is at hand. I think last week our editor comes up with this journal. Now coming to the anticipated trends, and our speakers mentioned about the changes in the instructional strategies, and we had to change. And I personally feel, as far as the knowledge domain is concerned, the cognitive domain is concerned, you can impart that through the online, maybe of C1, C2 or C3. But as far as the skill is concerned, you have to have the face-to-face contact. In post-COVID scenario, we have to see whether our students, they are having the desired level of the competency, and similarly whether we are having the required number of the patient having the finding. I am afraid probably we will not have the required number of the patient, and there will be the deficiencies of the skill. So to overcome that deficiency, King Edward Medical University is going to establish the advanced skill lab, so the students should have the required competency as far as the hands-on training is concerned. And the role model for us is the simulation lab of the Canada, Toronto, and also has the good simulation lab. The other institutions are having the simulation lab. King Edward is also going to establish the advanced skill lab and the simulation lab with state-of-art facility. That is one thing. And second is, every challenge comes with some opportunity. We have felt that there's a need of the specialist doctor as far as the intensive care is concerned, emergency medicine is concerned, and the most important, the infectious disease that is concerned. We came with the challenge of the dengue, we came up with the challenge of the corona, but the specialists in the infectious disease, they are less as far as the requirement of our country. So King Edward Medical University, inshallah, is going to establish the Institute of Infectious Disease in our new campus, Burike, Narwal Road, where we're having 230 acres of the land. And similarly, the telemedicine department is going to be a regular feature. We will have the professorial chair, and we will start the postgraduate diploma courses in telemedicine department, and the telepsychiatry services will remain continued. And another thing, we need to change our curriculum considering the current challenge. I personally feel in our undergraduate curriculum, there should be some changes as far as the family medicine that is concerned, and we have to incorporate something about the telemedicine as far as postgraduate that is concerned. We have to take care of the critical care medicine, infectious disease, and the emergency medicine. We need to expand these post-fellowship program, postgraduate program, so our country should have the human resource if we come up the same challenge in future. And the last thing, I think all these challenges we can overcome with these challenges with our team spirit and collective wisdom, and inshallah King Edward Medical University with the same spirit will overcome with all these challenges. Thank you very much, Professor Amir, Professor Iqbal, and all the management for giving me the chance to share my ideas about the objective which you just mentioned.
Thank you so much, sir. That was a very good presentation. We welcome our Vice Chancellor, Professor Dr. Muhammad Iqbal Khan, who has joined us during the presentation of Dr. Gondal. Dr. Gondal, we have a question. We actually have many questions, some of which you have already answered. But one question which we would like to ask you is that how can we quantify, Dr. Aisha Kausar asked this question, that how can we quantify the online assessments and self-directed learning activities in terms of teaching hours and contact hours as per the PMDC criteria?
I think you have to have a standard setting. and the standard setting, and then you have to make the competency which are required for these students. We are already having the competency chart for our postgraduate, and similarly the competency required for the undergraduate as far as the knowledge domain is concerned, the skill domain is concerned, the ethical and professional domain is concerned. The weightage in general, we give about 50% to the knowledge, 20 to 30% to the skill, and 20% to the skill, to the professionalism. So all these competency framework, when you are having, you can monitor those competency through your electronic monitoring system, and you can have a various scales, various feedback per pharma, through which you can monitor, you can assess that, and then your monitoring committee can formally come up with the final results. That is, that system is through, okay, we are achieving the desired result or not. But again, I will say this is a new scenario, and these instructional strategies, they are a new one, and we have to see whether we are achieving the desired targets or not. That depends upon the final assessment by the assessment committee.
The talk of Dr. Khalid was very useful. They are doing very useful project for the nation. Because it's the main institution of Pakistan. They are doing the telemedicine. I'm really impressed from that. And this idea should be taken by all of us to implement the telemedicine in the other institutions as well. Also they have talked about the online assessment they are using, learning management system they are using. They are doing a lot of work at their institution, and we'll take their consultancy, inshallah, for our institution as well.
And the first question is for Dr. Khalid m.Gondal. Sir, the question for you is that should medical education be shifted towards virtual learning, and will it be safe? Safe as in, will we produce safe doctors then?
I think this is a very important question. And before I respond to the question, Fahad, I'm just going to tell you, last year in October, we had the International Medical Educator Leadership Forum, and Dr. Janet and Professor Iqbal know that in Canada, every year they had the International Medical Educator Leadership Forum, and where 30, 40 countries they are being represented. I was there. And they were discussing about the artificial intelligence, and the question was whether this artificial intelligence is going to replace the physician of tomorrow, and the debate was going on. And the conclusion is this artificial intelligence cannot replace the physician of tomorrow, they can just support. So I think I will apply the same thing over there. The virtual teaching and training, they cannot replace the face-to-face contact. You know, when you develop the table of specification, you develop the competencies, you say the cognitive domains, you say the skill domain, you say the effect domain. Now all these domains, they cannot be covered through online teaching or virtual training. They can just support the face-to-face contact, or your competency can be supported by them, but that is not the replacement of your traditional teaching, your face-to-face and contact with the patient, and your clinical teaching, which we are having, I think, before the COVID and as per our tradition.
How did you reduce chances of cheating in online assessment in your setup?
A very important question, because we just had the experience of assessment of our supplementary students who were sitting in the different countries. We conveyed them the SOPs, and in addition to what Professor Ikram mentioned, we monitored the surrounding environment through a webcam, and we had the control of their PC. The room environment was monitored, 360-degree monitoring and 3D monitoring. They were there, so that there should be no chance of any cheating or any interaction.
I will now request Dean of Faculty of Health Sciences, Professor Dr. Amir, to share a few words with us and conclude today's event.
Thank you very much, Fahad. Actually, I wanted to say in millions of words, but the time is up. And as for the last 4 decades, this is my divine duty. I start the session, and usually I end the session as well now. So I'll end it by thanking all the speakers, the panelists. We have been into a very absorbing webinar, and the best part that I was sitting here and I learned a lot from all of us. And thank you very much. And the people who are on the screen as well as behind the screen, they deserve special thanks from me and from my management. Professor Janet, it was the startup from you, and it was invigorating. And your term has been used many times later part of the presentations, the synchronous and asynchronous. You can call it later on blended or unblended or hybrid. So many terms will come up. So this is another opportunity to divine and coin more terms. And with the passage of time, more will come. So Professor Khalid m.gondal, an interesting personality. You must have all enjoyed his presentation. Thank you very much, sir. And Professor Muhammad Iqbal Khan and my team of Professor Rifa and Dr. Ikram and Professor Rahila. Special thanks to you as well. It has been a sort of a global seminar for us. So we had views from across the world. And in this such a short span of time, you cannot expect more. And otherwise you can carry on. I wanted to have a day-long seminar, but a webinar cannot be a day long. So that's why we had to restrict to this much time. And we have overstepped the time, and we had it in our mind about 10 to 15 minutes. We could overstep, but we will not like to move any more on that. So thank you very much. Thanks the webinar team. And the best part of the webinar or best part of a discussion is that it leads to more questions while it has tried to answer a few. And that's the reason Fahad has been saying we may be looking forward to more webinars in future, and we will all be learning from these. So thank you very much. I'll end it with the Surah Al-Asr, and that's all about the discussion which we hold on. That what the Allah Almighty says, that Bismillahir Rahmanir Rahim wal Asr, that He is swearing by time, by the times all around us. Innal insana lafi khusr, that no doubt the humanity would be in a total loss. Okay. Innal insana lafi khusr illa alladhina amanu. But that means the first thing in any change you have to believe. If you don't believe, you cannot bring any change. You cannot adjust or adopt. And that's what the humankind or the mankind is. Illa alladhina amanu wa amilu salihati. Then you work in that direction. And then the good deeds you do in that direction. This webinar is also in the same direction and describing that. إِلَّا الَّذِينَ آمَنُوا وَعَمِلُوا الصَّالِحَاتِ وَتَوَاصَوْا بِالْحَقِّ وَتَوَاصَوْا بِالصَّبْرِ. So you always advise each other, you devise means and you discuss and you share, and then you try to follow that. And you have to be patient to see what changes you are bringing in. They will bear fruit, and they will bear more fruit. Thank you very much. It has been a great time with all of you, and goodbye and Allah Hafiz from all of us.